So what are the guidelines that we need to follow when we are teaching the mother to establish breastfeeding? Okay? So number one is that we have to minimize interference. Okay? So ibig sabihin, health workers like us, nurses and midwives, should avoid touching or handling the newborn unless there is medical emergency. Kapag po may nagpapasusong ina, hindi po dapat natin ini-interfere yung pagpapasuso if it is not a medical emergency. The focus should be uninterrupted skin-to-skin contact between the mother and the baby, and that will also promote bonding, warmth, and also promote early breastfeeding success. Aside from that, lagi nyo ding tatandaan that we should not support the use of pre-lacteal feeds. Ibig sabihin, we should not give sugar water, do not give formula or other pre-lacteals or liquids other than the breast milk. Sir, bakit po? Kasi nga po exclusive breastfeeding. We do not give anything to the baby but breast milk only. Now, early exposure po kasi to other liquids, not pre-lacteals like sugar water, formula, and other liquids po, aside from the breast milk, these can disrupt breastfeeding patterns and also affect the baby's gut health. So dapat po, there should be exclusive breastfeeding and this should be prioritized from birth up to 6 months lamang. Lagi nyo ding tatandaan that we have to follow or comply with Executive Order number 51 or what we call the Milk Code of the Philippines. Ano ba kasi ang nakasaad sa Milk Code or what is written in EO 51? It says there that the use of milk substitutes and related products is strictly regulated in hospitals under Executive Order 51, which aims to protect breastfeeding practices. So, ibig sabihin, EO 51 is a law in the Philippines that protects the breastfeeding practices and also advocates for exclusive breastfeeding. Now, bakit kailangan natin ng batas sa pagpapasuso? This law ensures that breastfeeding is the first and only feeding option provided to newborns unless medically indicated otherwise. It means that if there is no medical contraindication, dapat po ay exclusive breastfeeding po yung ating mga babies. Okay? So always remember that there should also be support to breastfeeding. Strict support to breastfeeding po dapat ang ating ginagawa or ina-advocate as nurses and midwives. Now, we have to encourage the mothers to practice exclusive breastfeeding, which means only giving breast milk to the baby. No water, no tea, no formula milk or mga bottle milk. Dapat po, exclusive breastfeeding for the first 6 months of life and strict breastfeeding supports optimal growth, immunity, and long-term health benefits for the baby. Lagi niyong tatandaan that breast milk is best for babies even up to 2 years. Pero dapat po, exclusive breastfeeding po si baby from 0 to 6 months of life. And after 6 months of life, continue breastfeeding, but the baby can already start eating solid foods. Yan po yung sinasabi sa ating EO 51. Aside from that, another part of your guidelines in breastfeeding is the use of bottles and pacifiers. Now, marahil tinatanong nyo, Sir, allowed po ba ang paggamit ng bottles and pacifiers? The answer is no. We should not offer bottles or pacifiers to the newborn because they can interfere with proper latching on and suckling. Magkaiba po kasi yung shape ng bottles ng nipple sa bottle ng magulang. Okay? So the shape of the nipple of the mother and the artificial nipple are different. And that may pose as a challenge for the baby pag siya ay maglalatch na sa nipple kung siya ay nasanay po na sumususo using the artificial nipple. It's gonna be very difficult for the baby to transition into using or sucking the breast of the mother if he or she is used to sucking the silicone nipple. Okay? It's gonna make it harder for the baby to learn to breastfeed effectively if we give them pacifiers and artificial nipples or bottles. Okay? So this can lead to what we call nipple confusion. Nipple confusion po ang tawag natin sa situation wherein the baby struggles to switch between the artificial nipple and the breast. Now, aside from that, you also have to tell the parents to preserve the colostrum. There is a practice po kasi that they throw the colostrum away. Ang sasabihin, let the husband suck the first breast milk of the mother because they believe that it is spoiled milk. Mali po yun. Never discard or throw away the colostrum. The colostrum is the thick, yellowish fluid produced by the mother's breast in the first few days after birth. And this is extremely valuable. Yung unang gatas po ng nanay, tinatawag natin na colostrum. Colostrum is packed with immunoglobulins. Ang dami po niyang mga benefits. Number 1 po dyan ang immunoglobulins, which provide crucial immune protection, and it also acts as the baby's first vaccine by defending the baby against infection. So the practice of throwing away of the colostrum is already antiquated. Nalaman na po because of research and science that colostrum is not actually spoiled milk. Ito po ay maraming antibodies which will prevent infection in the baby. Aside from that, you have to feed the baby using both breasts for as long as the baby wants. So sabi dito, let the baby feed for as long as he or she wants on both breasts because it will help relieve engorgement or yung paglaki ng suso na the full feeling of fullness of the breast. Okay? So masakit yon for the mother. It's gonna be very uncomfortable for the mother to have engorgement because they feel that their breasts are very heavy because of milk. Now, ang gagawin natin, we allow the baby to feed on both breasts until that they are satisfied. This ensures that the baby gets both the foremilk or yung gatas na rich in lactose na nakukuha niya on the first sucking, that's what we call the foremilk, and hind milk that is rich in fats. Ito po yung mga last drops na po ng suso ng nanay. Okay? So we let the baby suck the breast for as long as he or she wants for the baby to get the foremilk, which is rich in lactose, and the hind milk, which is rich in fats. Yung mga last drops ng gatas po ng nanay yon. And that will promote the proper growth of the baby. Always remember din as well that feeding the baby on both sides also helps the mother avoid the feeling of breast engorgement, and it also lowers the risk of mastitis or the inflammation of the breast tissues. Aside from that, you also have to assist the mother in finding a comfortable position. Bakit po? We have to help the mother and the baby settle to a comfortable position during breastfeeding because it will help provide a good support to the baby and also minimize the strain on the mother's body. Kasi kapag masakit na yung katawan ng nanay, the feeling of breastfeeding is very uncomfortable, ayoko na nga, hindi na magpapasuso si mother if the mother is not taught how to find a comfortable position during breastfeeding. Lagi niyong tatandaan that a comfortable position prevents backaches, and it also helps the baby latch on effectively, and it makes the breastfeeding experience a more pleasurable and bearable experience for both the mother and the baby. Aside from that, we also have to encourage early feeding cues, or we have to also observe the newborn for presence of early feeding cues. So sabi dito, we have to observe the newborn closely for feeding cues such as rooting, lip smacking, sucking movements, and when these cues already appear, we have to encourage the mother to gently guide her baby towards the breast. So sabihin, ma'am, if you already see your baby sucking, licking, okay, and may rooting reflex na, you have to put the baby's mouth near the nipple so that the baby will be encouraged to suck. Bakit po? This approach respects the newborn's natural instincts, and it also helps establish a positive breastfeeding experience for the baby and the mother. para po hindi iyak ng iyak yung bata. On the early breastfeeding cues pa lang, we already have to encourage the baby to start sucking by letting the baby near the nipple para po makapag-suck na po siya. Now, let us also familiarize ourselves with RA 7600 or what we call the Rooming In and Breastfeeding Act of 1992. Now, itong batas na po ito, this is a Philippine law that promotes and protects the practice of breastfeeding by keeping the mother and her newborn baby together after birth. Now, bakit importante yung batas na ito? This law ensures that immediately bonding and early breastfeeding are established immediately after delivery of the mother. Ang ginagawa po kasi before the creation of RA 7600, the mother, after she delivers her baby, goes back to the OB ward. Bumabalik po siya sa OB ward, while the baby is placed on the pedia ward. So they are separated after delivery. And the mother will have to visit her baby in the pedia ward just for breastfeeding. So wala pong maternal bonding doon, wala pong thermoregulation na nangyayari because the mother and the child are immediately separated after birth. But research has already proven that there is a detrimental effect of the separation of the baby and the mother immediately after delivery, and that's the reason why now we do not practice that anymore. So ang pinapractice na po natin ngayon is rooming in, or because of RA 7600, after the delivery of the mother, instead of being separated from the baby, ang gagawin na po natin is that the mother is moved to her room with the baby placed beside her. Ibig sabihin po, yung nanay at yung bata, gaya ng nasa picture, ay nasa iisang room na lamang po. Now, bakit ba importante ang rooming in or bakit importanteng magkakwarto yung nanay at yung bata? Now, this setup, which we call rooming in, means that the child is never separated from the mother unless, of course, there is a medical indication. Now, why is it necessary? Marahil nagtataka kayo. It supports successful breastfeeding. Yan yung unang reason why we need to do rooming in, because it supports successful breastfeeding. When the baby and the mother are kept together in one room, it encourages early breastfeeding, which is crucial, as we know, for both milk supply and the newborn health. Aside from that, if we room in the baby and the mother, it ensures continuous skin-to-skin contact. So being in close proximity with the mother and the baby allows for uninterrupted skin-to-skin contact, which will help regulate the baby's temperature, regulate the baby's heart rate, and even breathing. Kasi si mother, mahahag ka niya anytime she wants to hug the baby is near her. So she can just easily pick the kid up and hug her for skin-to-skin contact. So that is also one benefit of your RA 7600 or rooming in. Aside from that, maganda din ang rooming in because it also enhances mother and infant bonding or maternal and child bonding because it fosters a stronger emotional connection and also helps the mother respond quickly to the baby's needs. Contrary kapag separated po yung mother and yung baby, pag umiyak yung bata at maraming trabaho yung mga nurses, the nurses will not be able to attend to the needs of the child. But if the baby is roomed in with the mother, then if the mother hears that the child is crying, automatically and immediately, the mother can tend to the needs of her baby. So, maganda po yung kanilang maternal and child bonding because of rooming in. So, those are the three reasons why we have RA 7600 right now. We want to support successful breastfeeding. We also want continuous skin-to-skin contact to regulate the vital signs of the patient and also enhance maternal and child bonding. Now, let us also talk about the positioning of the newborn during breastfeeding. Lagi niyong tatandaan that proper positioning of the newborn during breastfeeding is essential for successful feeding and comfort for both the mother and the baby. Kasi kung maganda yung position nila, it's gonna be more comfortable for them during that procedure. Now, here are the key elements to consider when we are optimizing positioning during breastfeeding. Number one po, lagi niyong tatandaan, there should be a neutral neck position for the baby. So, ibig sabihin nito, we ensure that the newborn's neck is not flexed or it is not twisted, hindi po nakaganon or hindi po siya naka-twist ng ganon. The baby should be in a neutral neck position because a neutral neck position will allow the baby to be able to latch properly into the breast and also swallow the milk more effectively. Kaya dapat neutral neck position po yung baby, hindi po naka-flex or hindi po siya twisted. Aside from that, lagi nyo ding tatandaan that the baby should be facing the breast. Ibig sabihin, the newborn should be facing the breast directly. This alignment of the face and the neck will help facilitate a good latch. Mas maganda po yung sucking ng bata, and it also makes it easier for the baby to suckle efficiently. Aside from that, the baby should be close to the mother's body as much as possible. So, ibig sabihin, we have to position the newborn close to the mother's body. And bakit kailangan gawin ito? It promotes bonding. It also helps the baby feel more secure, and it also allows the mother to support the baby's head and body comfortably. So, dapat yung mother nakayakap po sa kanyang anak when they are breastfeeding. Okay? So, aside from that, there should also be full body support. Sinusuportahan po ng mga kamay ng nanay yung katawan ng bata. We have to make sure that the newborn's whole body is supported, and that the baby should be held in a way that their backs, their neck, and head are supported for them to latch properly and also to minimize the discomfort during feeding. Now, dapat po nakasupport yung inyong arm and on the neck and the head of the baby along with the full back of the baby. So, dapat naka-cradle po kayo sa mga babies na nagbe-breastfeed. Now, what are the additional tips that I can tell you on how to properly help the parents and the baby to be in a comfortable position during breastfeeding? Lagi niyong tatandaan that we can use pillows or cushions for support. Bakit natin gustong gawin ito? We want to achieve the best positioning as much as possible. So, mothers can be allowed to use pillows or cushions for support by helping them to maintain a comfortable posture during feeding para po maging pleasurable at pleasant yung experience nila so that they will continue breastfeeding. Aside from that, we can advise the mother to experiment or explore different breastfeeding positions. Lagi niyong tatandaan that every mother and baby pair is very unique. So it is essential to explore different breastfeeding positions like the cradle hold, cross-cradle hold, side-lying position, or kung ano pa man that they find is comfortable. So, hindi po lahat-lahat ng mga pasyente natin ay may iisang breastfeeding position na gusto nila. So, it also varies depending on the circumstance or situation of the patient. Pero, what we can tell our patients is that they should try to experiment and explore in using different breastfeeding positions to find the position that they really like and they really enjoy so that they will continue breastfeeding. And we will be talking about the different positions of breastfeeding later on as we go along our discussion. Now that we are already familiar with the positioning of the baby during breastfeeding, pag-usapan naman po natin, let's talk about proper mouth attachment. When we speak of mouth attachment, it refers to the way a newborn latches onto the mother's breast during breastfeeding. Ito po yung positioning ng bibig ng bata during the breastfeeding period. Now, it is a critical aspect, ang latching on, it is a critical aspect of breastfeeding that influences effectiveness of milk transfer and the comfort of the baby and the mother during breastfeeding. Lagi niyong tatandaan that proper mouth attachment ensures that the baby can effectively extract milk from the breast of the mother while minimizing discomfort for the mother. Kasi masakit po kapag hindi naka-properly attached yung bata at nagsasak po siya. So the mother will feel discomfort and the baby may not be able to extract milk as effectively kung hindi po maganda yung kanilang attachment or what we call latching. Okay? So what are the things that you need to remember in proper attachment or latching? Dapat merong effective milk transfer. Okay? So we should ensure that the baby receives adequate milk for nourishment, kaya dapat they are properly latched to the breast for effective sucking. Aside from that, we make sure that the baby is latched properly onto the mother because we want the mother to feel comfortable during breastfeeding. Because if the baby is properly latched or attached to the breast of the mother, it also reduces the pain or the risk for sore nipples and breast pain. Hindi po siya masakit para kay nanay kasi maganda yung attachment ng bata in the breast. Aside from that, we also want to prevent air ingestion. If the baby has poor attachment, the baby may swallow air during breastfeeding, leading to air ingestion or possible colic. So, in your attachment or latching of the baby, we have to minimize the likelihood of colic and gas discomfort in the baby by reducing the amount of air being swallowed during their feeding. So, ano nga ang pag-uusapan natin ngayon? Our next topic will be proper mouth attachment. So, you have to remember that the baby's mouth should be wide open during breastfeeding. So, the baby's mouth should be wide open before they latch to the breast, and a wide latch yung ganun po siyang susubo sa suso, allows the baby to take in enough breast tissues along with the nipple, which is essential for effective feeding. Ibig sabihin, dapat malaki yung nganga ng bata so that they can properly engulf the nipples, cover the nipples and the areola with their mouth so that breast tissues can be placed inside the mouth of the baby so that they can squeeze it using their mouth muscles, thereby lalabas po yung gatas doon. Aside from that, you have to remember that the positioning of the lips of the newborn when they are latched should be flanged outward, or lower lips should be turned outward. Okay? So the lower lips should be outward, and that will create a good seal around the nipple and areola. Ibig sabihin, there will be no air ingestion if there is a good seal that is created by the lower lip that is turned outward. Now, this positioning can help prevent any slipping or any yung mga lalabas na gatas. Okay, it prevents slipping of the milk and ensures that the baby gets enough milk as much as possible. Aside from that, the chin of the baby should be touching the breast. Ibig sabihin, the chin should be in direct contact with the breast of the mother. Ganun po kalapit yung suso dapat from the face of the baby. So, the baby's chin, remember, should be gently touching the breast, and this direct contact will help encourage the baby to open their mouth wider and latch effectively. And that will ensure that the nipple is positioned deep in the baby's mouth kasi malapit po yung chin ng bata doon sa nipple ng nanay. Mas maganda po ang sucking if the baby's chin is near the breast or directly in contact with the breast of the mother. Aside from that, you should observe slow, deep sucking with pauses. Ibig sabihin, once the baby is already attached or latched onto the breast of the mother, the baby's sucking motion should be slow, it should be deep, and it should be with occasional pauses. That means that the baby is sucking milk and swallowing milk because of the process na ginagawa niya. Okay, nagpo-pause po yung bata. This rhythmic movement of the mouth also indicates that the baby is effectively drawing out milk from the breast, and it also allows the mother to monitor the baby's cues for feeding. Okay? So, ibig sabihin, pag yung bata, ganun lang siya sumususo, ibig sabihin the baby is not properly attached. Okay? Because the sucking should be slow, deep, and with some pauses to accommodate the time wherein the baby will have to swallow the milk. Okay? So aside from that, we also ensure to prevent colic during breastfeeding. Ibig sabihin nito, proper attachment is important not only for the effective feeding of the baby but also for the baby's comfort. Lagi niyong tatandaan that a correct latching can help prevent colic or kabag in the baby, which is characterized by abdominal distension due to swallowed air. Bakit natin ayaw sa kabag, sir? Because if there is too much swallowed air, the abdomen of the baby will become distended. And if the baby's abdomen becomes distended, mangyayari, the baby will feel uncomfortable, the baby will cry overnight, no? Magiging uncomfortable po yung baby. So we have to make sure that a proper seal is present during breastfeeding to reduce the amount of air the baby ingests during feeding. And that will minimize the discomfort of the child. So yan dapat yung mga ginagawa natin. So as you can see, no, during the breastfeeding latching, the baby's mouth should be wide open. The lips should be turned outward. The baby's chin should be touching the breast. And the sucking motion should be deep and slow and with some pauses, as you can see in the picture provided. Now that you know how a proper latch or proper attachment looks like, it is now time for you to initiate breastfeeding. So paano na ninyo gagawin yon? How will you do that? How will you initiate breastfeeding? Number one is that you have to look for a quiet place. Ibig sabihin, you have to choose a calm and a quiet environment to minimize distractions during breastfeeding. Bakit pa kailangan, sir, ng quiet place? This helps both the mother and the baby to focus on the feeding process. And it also promotes a more relaxing experience for the mother and the baby. Aside from that, you also have to find a relaxed position for the mother. That means that you have to encourage the mother to find a comfortable and relaxed position for breastfeeding. This could either be sitting or lying down, but the important thing is we ensure that she feels at ease and she feels comfortable while feeding her baby. Aside from that, you also have to provide back support to both the mother and the baby. You have to use pillows or cushions to give the mother and the baby adequate back support para hindi pumangalay ang kanilang likod. Proper support can prevent discomfort and fatigue to the mother, allowing her to concentrate on feeding without straining her back and other parts of her body. Aside from that, you have to tell the mother to support the feet of the baby. We have to ensure that the baby's feet are supported during feeding. Hindi po dapat siya nagdadangle, no? So this helps maintain a stable and secure positioning for the baby, making it easier for them to latch and feed effectively. So the hand of the baby, of the mother should be supporting the body and the feet of the baby so that it will not dangle. Aside from that, we should avoid hunching the shoulders. Dapat po hindi nakaganon yung nanay. Remind the mother to keep her shoulders relaxed and not hunched because that will affect her posture. Importante po ang posture ng nanay kapag siya ay nagpapasuso. Proper posture can reduce the tension and discomfort felt by the mother in her neck and in her shoulders. So dapat po hindi po siya naka-hunch. Because if she is hunched like this, madali po siyang mangangalay, making the breastfeeding experience less enjoyable. At baka ayaw na niyang magpasuso in the long run. Aside from that, do not scissor the breast. Tell the parents to not scissor the breast. As you can see on the photo here, yung babae po, siniscissor hold niya yung breast. Okay? It is important to avoid a scissor grip on the breast where the fingers might pinch the nipples together. Because this can lead to a blockage of what we call the lactiferous tubules, which will affect the milk flow and potentially even cause pain and engorgement in the mother. Instead, anong gagawin natin kung hindi pwede ang scissor holding during breastfeeding? We use a gentle supportive hold to maintain the breast's natural shape. So anong gagawin natin? We tell the mother to support the breast. Dito po, papaganon niya, hindi po niya isi-scissor hold ng ganon. Okay? So those are the guidelines that you need to follow in breastfeeding initiation. The next thing that we are going to discuss is the different holds in breastfeeding. Choosing the right breastfeeding hold can significantly impact the comfort and effectiveness of feeding for both the mother and baby. Meron po tayong mga 6 na breastfeeding holds which have their own advantages and uses. So yung una pong pag-uusapan natin is what we call the cradle hold. When we speak of the cradle hold, this is also known as the classic breastfeeding position. And if the baby is nursing on the right breast, the baby's head must also be rested on the right crook of the mother's arm. So as you can see on the picture, the baby is sucking on the left side of the breast. Therefore, the left arm of the mother is supporting the baby's head. So dito po, ang description natin in the cradle hold, the mother holds the baby across her lap with the baby's head resting on the crook of her arm. And the baby's body should be turned towards her with the belly against her. So dapat po ay yung belly to belly po sila. And kung ito yung ulo ng bata, ito yung crook ng nanay, dito po siya sa side na to sususo. Ang tawag po natin dyan is the cradle hold. And this is best for term babies who are delivered via NSD. So dito po, ang itsura ng ating cradle hold. The mother should also be embracing the baby, supporting the baby's body, and where the baby sucks, doon na breast, doon po dapat nakarest yung ulo ng bata. That is what we call the cradle hold. The next breastfeeding hold that I will teach you is what we call the cross cradle hold. The cross cradle hold is also known as the crossover hold. And if the baby is nursing or sucking on the right breast, you have to use your left arm and hand to support the baby's head. So as you can see on the photo, the baby is sucking on the left breast. The right arm of the mother naman po ang nagsusupport sa body and head of the baby. Now, dito po sa ating cross-cradle hold, it is similar to the cradle hold din. But the mother uses the opposite arm to support the baby's body. Okay? So, ang advantages po nito is that it is best for babies who are small. Yung mga premature po, na si single hand lang po ni mother na isupport yung bata kapag siya ay nagpapa-breastfeed. It is also good for infants who have trouble latching on. Yung mga bata po na hindi marunong mag-suck, at least the other arm of the mother will be able to reposition the nipples and the mouth of the baby to support the baby to latch or attach properly. Maganda din po ito sa mga preterm babies who are able already to suck. So at least nasa single hand po ng nanay yung ating pong mga babies. Okay? So like I said, this is best for babies who are small and those who have trouble latching on. Next, let us learn about the football hold. Ang football hold po, the mother holds the baby at her side with the baby's legs tucked under her arm, similar to carrying a football. And the baby's head is positioned at the breast level, and the mother supports the back of the baby's head with her hand. So as you can see, yung mother po, parang naka-clutch bag or nakahawak sa football. So bakit po maganda ang football hold na ito? It's very unusual for us kasi first time lang po natin makakita ng mga mothers na magpapasuso na parang nakahawak ng clutch bag. But it is important for mothers who have cesarean section, who delivered via cesarean section, because this position will allow the mother to avoid putting pressure on the incision area. Kasi nga po, nandito po sa side yung bata, the incision area is here, there is no pressure placed on the incision area. Aside from that, the football hold is also advantageous for babies who have trouble latching on. And aside, kasi nga po, since nakaipit dito, the mother can use the other arm to reposition also the breast. It is also good for women with large breasts. So yung mga malalaki ang suso, syempre hindi niya ma-cradle hold yung kanyang anak because of the heft of her breasts. So pwede niyang mag-football hold na lang po. And it is also good for twins. Those babies who will have to simultaneously suck on the mother's breast o sabay na silang dududo kapag magpo-football hold po yung nanay. So that is what we call football hold. It is best for cesarean section to avoid pressure on the incision area, best for babies na may problema sa latching on, best for women with large breast, and also best for twins na sabay magdedede. And of course, we should never forget the side-lying position. So dito po, the mother lies on her side with the baby lying beside her and facing her as well. So the mother can use her arm to support the baby's back and head and even place a pillow on the baby's back. So maganda po ang ating side-lying position because it is excellent for nighttime feeding. The mother will not need to stand up or sit down just to feed the baby. So even while on side-lying, the mother can continue scheduled feeding. as it allows both the mother and the baby to rest while breastfeeding is happening. It also can be comfortable for mothers who are also recovering from birth and yung mga pagod na sa kakaanak. So you can also tell the mothers to rest for a while during the first hours after delivery, and they should feed the baby na lang using the side-lying position. We also have what we call the laid back or the reclined position. I think this is not included in the handouts. Dito po sa laid back or reclined position, the mother reclines comfortably, allowing gravity to help her position her baby. So dito po, high Fowlers or semi-Fowlers po yung ating pasyente. Naka 45-degree angle po si nanay. And the baby lies tummy down on the mother's chest or even the stomach. As you can see on the picture, the baby is prone. Naka-tummy down po siya doon kay nanay. So what is the advantage of the laid-back position? Maganda po ang position na ito because it can promote a relaxed feeding experience for the mother, and it also encourages skin-to-skin contact and may also stimulate the baby's natural breastfeeding instinct, or pwedeng mag-crawl yung baby to find the nipple if they are in the laid-back position. So that is the beauty of the laid-back position. Of course, we also have the standing position while breastfeeding. So dito po, it is best for mothers who are working or have something to do or are already tired of lying down. So the mother stands while supporting the baby against her body, as you can see on the photo, and pwede pong gamitin nila dito yung football hold or even the cradle hold or the cross cradle hold. So what are the advantages of standing while feeding the baby? Now, this position can be useful for quick feedings while the mother and the baby are on the move. Kunwari, nasa biyahe sila or may pupuntahan at nagutom yung bata, the mother can do the standing position. Or if the mother needs to multitask, so kunwari, kailangan niyang magluto habang nagpapadede, the mother can use the standing position. Now, if you ask me kung ano yung pinakamagandang breastfeeding position, gaya ng best feeding method kanina, wherein the mother is the one who determines the best breastfeeding method for her baby, dito naman po sa mga breastfeeding positions natin, the mother also gets to decide the most comfortable, the most appropriate, and the best breastfeeding position for her and her baby. So dapat ay tulungan po natin yung mga nanay to be familiar with these different breastfeeding positions. By letting the mother find the right breastfeeding hold, this can enhance the comfort and effectiveness of breastfeeding. Mothers should be made to feel free to experiment with the different positions that they want to discover, and they have to explore what works best for them. Hindi po dapat tayo ang nagdidikta kung ano yung position na gawin ng nanay, because only the mother knows what comfort feels like during breastfeeding on a specific position. So the key here is to ensure that both the mother and the baby are comfortable and that the baby is properly latched for effective feeding, at yung nanay na po ang magdedetermine kung ano yung magandang posisyon para sa kanya. After feeding the baby, you should also burp them. Okay? Burping is a simple yet vital part of feeding that can help ensure that the baby is comfortable and already contented. Now, by using proper techniques and timing of burping, you can minimize the discomfort of them from their swallowed air, allowing for more enjoyable and feeding experience. Lagi niyong tatandaan that burping is an essential practice for feeding the baby, as it helps to expel any of the swallowed air that can cause discomfort or formation of gas in the stomach or the abdomen of the baby. So ano yung gagawin natin for burping? Number one is that after feeding, it is crucial to burp the baby to release any air that may have been swallowed during feeding. So this will help to prevent discomfort, prevent colic, and even the gas-related issues, as milk can be a gas-forming agent in some infant. Yung milk kasi nakakapag-form ng gas doon sa ating stomach, so kailangan i-burp natin yung mga bata so that we can minimize the discomforts brought about by gas distension and even colic. Aside from that, burping should be ideally done on the first 15 to 20 minutes after feeding the baby. This timing of 15 to 20 minutes will allow the baby to digest some of the milk before burping, making it easier for the baby to release any of the trapped air in their stomach. Para makapag-burp po sila, we allow 15 to 20 minutes for them to digest some of the milk. Now, one effective position for burping is to hold the baby against the shoulders, as seen in the picture, and we ensure that the baby is securely supported with the both hands of the mother, with their head resting on the shoulders of the mother, and the baby is also resting against the chest of the mother. So ang gagawin natin, with the baby in this position, we gently tap or rub the back of the baby with light, firm strokes, and you can also use the palm of your hands or your fingertips to create a gentle tapping motion. So ulit-ulitin lang po natin yon. We have to keep the taps rhythmic and soft, allowing the baby to relax while expelling the air. And alternatively, you can also try to other positions of burping. Pwede din pong seated yung baby, and then i-cross lang din natin sila sa ating lap, and then you do light tapping lang po sa kanilang likod. Okay? So that will now promote burping in the baby. Now, what are the signs that the baby has already successfully burped? Number one is you may hear a soft burp, or you may also see baby to be relaxed after feeding. So, ibig sabihin, pag nakarelax na po yung bata, may nakarinig kang soft burp, ibig sabihin na expel na niya yung air. So, some babies may not burp every time, no? And that's okay for as long as they are already comfortable. Sir, wala naman akong narinig na dighay, hindi naman nag-burp yung bata. That's okay. As long as they look comfortable, that is already okay po. As said earlier, breast milk is best for babies, and as much as possible, we prevent the baby from drinking cow's milk or formula milk. Mas maganda po ang mainom niyang gatas ay breast milk po. And in this slide, we will be learning about the difference between the breast milk and the cow's milk. So please take a screenshot na lamang po for you to be guided accordingly, but we will not be discussing all of the details below because some of them are self-explanatory. Now, why do we need to learn the difference between the cow's milk and the breast milk? The breast milk and the formula milk, they serve as the fundamental sources of nutrition for infants. But they have distinct differences in composition, in benefits, and in other characteristics. So number one po, the breast milk is nutrient-rich. The breast milk contains the perfect balance of proteins, fats, carbohydrates, vitamins, and minerals that is tailored to the infant's needs. Meron din po siyang immunological components or antibodies. It is rich in antibodies, in enzymes, and other factors that can help protect the baby from infectious diseases from the external environment. Aside from that, the composition of the breast milk also changes over time. Ibig sabihin, nagbabago po siya while the baby grows and develops. The more protein na kailangan na ng bata, nag-a-adjust din po yung breast milk ng nanay. So, the composition of the breast milk changes over time to meet the evolving nutritional needs of the growing baby, such as higher fat content, higher protein content. So, nag-change po yun. Aside from that, you have to remember that the breast milk is easily digestible because it contains the protein called lactalbumin. Mas mataas po sa lactalbumin ang breast milk, which is the protein found in the breast milk, compared to casein. And ito po ay mas madaling matunaw because of that concentration. So, ibig sabihin, they are not that constipated if they are breastfed compared to when they are fed cow's milk or formula milk, because in this, the casein is higher compared to lactalbumin. So, all in all, the message of this slide is that even if the commercials say that Promil or other milk formulas can lead to talented babies, wala pa rin pong tatalo sa breast milk ni nanay. This is gonna be our last slide on breastfeeding at pag-uusapan po natin ang physiologic weight loss. Okay? So, physiologic weight loss refers to the expected loss of body weight that occurs in newborns during the first few days of life. So, normal lang po na gumagaan yung bata on the first few days of life, and typically, this loss ranges from 5 to 10% of their birth weight. So, that is approximately 6 to 10 ounces for a newborn who is weighing 6 to 10 pounds. So, ibig sabihin, it is normal and expected phenomenon in these newborns that they lose some of their weight after delivery. Now, kailangan nating i-understand yung reason kung bakit may physiologic weight loss so that we can properly advise the parents or tell the parents what is happening to the baby para hindi po sila mag-alala. Now, what are the reasons why there is physiologic weight loss? Number one, gumagaan po yung bata on the first 5 days of life because the newborn is not anymore under the influence of maternal hormones. These maternal hormones po kasi progesterone, these are sodium and water retaining. So yung progesterone po, napunta kay baby, so si baby naging nagkaroon na din siya ng sodium and water retention. And because of that, after delivery, since the baby is not anymore under the influence of maternal hormone, the baby will be able to effectively evacuate na po yung kanyang mga hormones, wala na pong mga sodium and water retention, kaya po gumagaan yung bata. That is the reason why the baby has a slight loss of weight kapag siya ay not under the influence of the maternal hormone, kaya po yun nangyayari on the first 5 days. Aside from that, on the first few days of life, the baby will already start to void and pass stool. And because of that, natural that the baby will lose weight if they already start to defecate and micturate. Because syempre nakilo nyo yun nung nagkumuha kayo ng anthropometric measurement at birth weight, di ba? So, it's normal for them to lose a little weight because they already start to void and pass stool and nawawala na din yung sodium and water retention. And lastly, always remember that the breast milk has low calorie. That means that on the first 3 days of life, yung naiinom po ng bata is colostrum, and they have low levels of calorie during that time, and that is the reason why the baby has low calorie, kaya nagkakaroon siya ng weight loss on the first 5 days. So ulitin natin ha, yung first reason why there is physiologic weight loss is that the newborn is not anymore under the influence of the maternal hormones, which are sodium and water retaining. Kaya po siya gumagaan. Aside from that, the baby already starts to defecate and micturate, and that's the reason why the baby may lose weight on the first 5 days. And lastly, the colostrum has low calorie, and the breast milk produced by the mother on the first 3 days is colostrum. Therefore, on the first 3 days, the baby has less caloric intake. Therefore, hindi po siya bumigat on the first 5 days of life. And those are the reasons why there is what we call physiologic weight loss. Sir, nakakatakot po ba to? Sir, is this reportable to the doctor? No. This is a normal weight loss. This is a normal phenomenon. And that concludes our recorded lecture on breastfeeding. At sana po ay marami kayong natutunan sa akin. And I also hope that you will practice all the things that you learned from me when you go for your duty or when you become professional midwives and nurses. Muli, ako po si Teacher Jeffley. Maraming salamat sa pakikinig and enjoy the rest of the day. Bye-bye!